Melatonin is known for its role in sleep control, but it has a range of other roles and potential benefits. Optimal levels will ensure proper sleep quality, brain and gut health, reduced inflammation, and more. Melatonin levels are a marker of sleep quality and overall health. Melatonin supplements can increase these levels. In a review of 35 studies, researchers found that melatonin supplementation slightly improves sleep quality. Melatonin shows promise in improving insomnia and reducing jet lag. It also doesn't have any serious side effects. Although the optimal dose is not yet determined, researchers recommend a low dosing range. Even at low doses, there is already a significant increase in melatonin levels after the administration. The recommended dose for the elderly is from 0.3 to 3 milligrams taken around 1 hour before bedtime. Folate and vitamin B6 boost the formation of serotonin, which is the precursor of melatonin. In rats, vitamin B6 injections enhanced melatonin production. After 2 months of B6 injections, the blood levels of melatonin increased by 35%. Additionally, zinc and magnesium increase the formation of melatonin from serotonin. They bind to activate the AANAT enzyme. This increases the affinity of serotonin for binding to this enzyme. Zinc supplementation increases melatonin levels in rats. Some food sources that can increase your melatonin levels are tomatoes, walnuts, barley and rye, strawberries, cherries, olive oil, unprocessed cow's milk, grape wine, and beer. There are certain things that can decrease your melatonin levels, like drugs. Beta blockers are drugs that help lower blood pressure, and beta blockers decrease melatonin's release. They do this by inhibiting specific receptors. And non-steroidal anti-inflammatory drugs, including aspirin and several other over-the-counter painkillers, suppress nighttime melatonin levels. Blue light exposure at nighttime can reduce melatonin levels and narrow the time window of melatonin secretion. Aging. The pineal gland, which produces the melatonin, contains cells called pinealocytes. The number of pinealocytes decreases with age. This then decreases the melatonin production. Fasting. Fasting reduces the nighttime secretion of melatonin. Short-term fasting for 2 to 7 days reduces blood melatonin levels by 20%. And nutrient deficiencies like folate, magnesium, and zinc are linked with lower melatonin levels in rats. During aging and Alzheimer's disease, MT1 receptor expression in the SCN and the cortex decreases. MT2 receptor expression is also reduced during Alzheimer's disease. Luzendol is a competitive MT2 melatonin receptor antagonist. This means that it blocks the receptor's function. P-dot also blocks the MT2 melatonin receptor. Caffeine blocks melatonin signaling and melatonin transmission. Vitamin C, vitamin D, and vitamin E are important antioxidants. Melatonin also has antioxidant activity. It can synergize with each vitamin individually to make a more powerful effect. In animals, alpha-lipoic acid works to scavenge free radicals. This means that it stops oxidative damage and has an antioxidant activity. When it's used in combination with melatonin, alpha-lipoic acid stop DNA damage 3 times more effectively than when it was used alone. Melatonin and alpha-lipoic acid work together to protect calf DNA from oxidative stress. Glutathione is a potent antioxidant that decreases lipid, which is fat, breakdown. Melatonin and glutathione combined have a greater antioxidant effect than when either was given individually. Their antioxidant activity combined to have a greater effect in rats' livers. Melatonin also helps to stimulate glutathione activity in a rat's brain. They work together to eliminate peroxides and free radicals that cause oxidative damage. You can check out my videos on alpha-lipoic acid and on glutathione for more information about these. Selenium has free radical scavenger effects. It protects nerve cells and it restores the activity of antioxidant enzymes. Melatonin and selenium work together to improve the treatment of brain ischemia and consequent damage in male rats. This combination helped to reduce injury and it prevented brain inflammation. The EGCG catechin found in green tea. It's responsible for most of the antioxidant effects of green tea. It prevents oxidative damage and it protects cellular DNA. However, high doses of the EGCG or green tea extract can cause liver damage. Melatonin reduces the toxicity due to an EGCG overdose. In one study, researchers gave mice toxic and lethal doses of EGCG. Melatonin extended the survival time of mice that were given these toxic doses of the EGCG. Meanwhile, it also helped to reduce liver injury caused by non-lethal toxic doses of EGCG. Resveratrol has both antioxidant and anti-inflammatory activities. However, it can also exhibit pro-oxidant action and it can contribute to oxidative damage in excessive amounts. Resveratrol, in the presence of other antioxidants, loses its pro-oxidant action and acts as an antioxidant. Melatonin was highly effective in reversing resveratrol's pro-oxidant DNA damage in calf DNA. However, they do not combine to make a greater synergistic antioxidant effect.